there is no code and no standard about how wireless is deployed in healthcare, or anywhere else for that matter. It's for the most part based on manufacturers' recommendations. So what we've developed is kind of what we call internally a standard for our members to deploy wireless that gives them the ability to make that as reliable as possible and as much like a utility as all the other utilities in your building are. And we talk about embedding wireless in the base building, and by that we just mean think about it before you start to build the building, design it into the building. Don't cheapen it just because it can be cheapened, because there's no code that governs how it's deployed in your building. Deploy it so that it works properly, and then you'll have a much more reliable, robust wireless network. And it's one that both your guests and patients can rely on, but also your clinicians and your staff. Really, one of the key underpinnings of that is a trusted infrastructure. And because wireless is so difficult to implement well, we have stepped into the wireless area, and it's very important to us and to our members. And we talk to our members just like wireless is a utility. And really, it's become a utility. I mean, we all expect wireless to work wherever we are, if it's your iPhone or your Samsung device. But clinicians in hospitals expect wireless to work also. That's one of the key issues with wireless in healthcare, and that is, in many cases, it's not implemented well, and so the ability of a clinician to be mobile, or the ability of a clinician to connect a clinical device, is sometimes impeded by the design of the wireless network. The whole idea of trusted wireless is to help our members create trusted wireless networks. What we call the trust equation is a combination of RF, layered networks, and also security. And so all those three things together equal a trusted network, and there are certain ways that we accomplish each of those three elements of a trusted network. It starts with RF. You have to have pristine RF, and then we layer networks, and what we try to do is segregate guest traffic from enterprise and clinical traffic. And we really recommend very strongly to our members that they never intermingle their guest traffic on the same network with enterprise and clinical. What happens is, in almost every hospital, the hospital ends up being an ISP for their guests. So you see 90+% of the traffic, both in terms of airtime and throughput, is guest traffic. As a result of that, we've come up with a system or a way to segregate that traffic in these layered networks that give us the ability to entirely segregate clinical and enterprise traffic away from the guest network that the hospital provides for their guests and patients. That's why we've created the Trusted Wireless Health program and are educating our members about how to effectively implement networks, layer the traffic, and give them the ability to connect any device at any time. And then for the guest network, it is an open but controlled network. On the other side, with clinical and enterprise, it is, in an ideal world, it is authenticated and authorized traffic as that device on-ramps to the secure network.